You're listening to Idea Collider, a show that explores the world of asymmetric learning. On this show, I will sit down with pharmaceutical experts and business leaders to discuss how to embrace uncertainty and the different learning style that follows. I'm your host, Mike Rea. Let's get into the show. So Brian, so delighted that you've been able to join us on the podcast, especially that it coincides with the release of what for me is a really important contribution to this conversation around pricing and value and innovation. Could you start just by letting everyone know, who you are and how you got here?
Okay, well, I'm what they politely call an industry veteran, which is a nice way of saying that I'm quite old now. I entered the industry. I remember walking into the doors of my R&D lab on the 6th of February 1978. So it gives you an indication of how old I am. In a place you probably know, Mike, actually, a place called Fordham in the north of Newcastle. And I worked in as a Pharma R&D chemist for 5 years, and then I worked in the industry as in Pharma and medtech in commercial roles for another 15 years. And then so I worked through I started with a company called Sterling Winthrop, which is now part of Sanofi. I went via a company called American Cyanamid, which is now part of Pfizer. And I think the last job in the industry I had was with Boehringer Mannheim, which of course is now part of Roche. And then about 22 years ago, I've always had this, on all these management development centers, I've always scored off this scale on this curiosity and needing to learn things. That's how I was a scientist in the first place. And I left and went back to university to do my PhD. My PhD was in the effectiveness of strategy formation processes in the industry, or in other words, why do some of us make strong strategies and others make weak strategies? And for the past 24 years now, I've spent my time researching that topic, basically trying to understand how the industry works. And the output of that has been 8 books and a couple of dozen academic papers and about 300 industry articles. So I spend my time writing and researching, and I work with companies too. I must have worked with most of the major players in the industry in the last 24 years. And that's what I do. The best way to shorthand that is what my teenage daughter says. Any of our listeners who have teenagers will understand that actually my main job is a taxi driver. And not so long ago, I was driving them around and I heard this whispering in the back. And one of them must have asked something along the lines of, "What does your dad do?" And my daughter said, "He's a geek." And that's essentially what I am. I'm a geek about the industry and its evolution and how its business model evolved and how we compete in the industry. So, and that's what I am, and a geek.
Fantastic. Actually, that's a word that I use for myself. If people in the industry ask what I do, I sort of talk about, I'm a pharma innovation geek. So hence my interest in books like yours and the kind of contribution.
My wife likes to say, Brian enjoys doing research. It's so much easier than having a social life.
Excellent. Well, actually, that probably differentiates you and me because you've got a massive ability to do research in a way. I find the outputs of what you and the folks in my team do genuinely fascinating. So, I'm not very good at being a geek, but I am very interested in it. And certainly, this latest book, I was an evolutionary geneticist, biologist, a long time ago. So I've always enjoyed your kind of view of ecosystems and evolution and selection pressures and so forth. So, do you want to sort of give us a hint of what you aimed at in this book, and probably as importantly for listeners, because we've had Peter Kolchinsky on this podcast, and we've had John LaMartine very recently on the podcast, talking about their books, which I think are similar in similar attempts than yours. Could you tell us, what the aim of this book was and how yours sits next to theirs?
Well, both, Peter and John, his work, both I respect enormously, but then both contributed to me. They were both among the 80 people that I interviewed for this book. Although as I've come to it, I think I've taken a different approach and a rather wider approach. I think one way to describe it is that this book is motivated by fear. There's a couple I know who are, and like who've been married for many, many decades, and like all couples have always bickered, like we do, but who increasingly have in the last few years that this bickering has got out of hand and become really quite negative and destructive. And I'm worried that they're going to split up. And that couple are the industry and our society, in particular US society, because the US is the epicenter of supply and demand in pharmaceutical innovation. So this book's motivated by the fear that social contract that the industry is built on, society says, we'll enable pharmaceutical innovation with temporary monopolies and funding basic research and educating people and all of that stuff. And the industry in return promises to deliver these drugs that society needs. And I'm worried that social contract will break down. And I know that both, one of the things that Peter and John and I all have in common is a recognition of that tension, that social contract is fraying. So as I explained to someone recently, in a sense, this book is a bit of an attempt to be a kind of relationship counselor, where I'm trying to get the two sides to understand each other better. Because if they broke up, if that social contract frayed, if either side walked away from it or, reduced their commitment to it, that would be a tragedy for everybody concerned. I mean, there isn't anybody anywhere that doesn't directly or indirectly or need pharmaceutical innovation or is going to need it. It's been a very successful marriage for the past few decades, and I don't want it to end. So that's what motivated the book. I think perhaps the difference between where Peter and John and I covered it and where I covered it, I'm this it's this strange academic beast, and academics have to have they have to have an underlying perspective, okay, and as you know from my previous books, my particular work is evolutionary theory, and essentially that's an aspect of complexity theory. So I look at pharmaceutical innovation and say, look at all of these entities involved, everything from academic researchers to the NIH, to patient groups, to the US Patent Office, to the FDA. These are all creatures that are interacting and adapting to each other. And to an academic, that is a complex adaptive system, which means, therefore, that the critical implication of that is that the drugs we get and the prices that we pay for them are emergent properties of a complex adaptive system. But like that seems obvious, but of course the dominant metaphor that we use in the industry is pharmaceutical innovation as a machine. When you hear people talk about we ought to control prices, or you hear people about saying we need to have free prices in order to encourage innovation, they're effectively thinking of pharmaceutical innovation as a kind of machine where there's a big lever that you pull, and that lever says either you pull this lever this way, you get more innovation, you pull it this way, you get lower prices. And that is a very poor metaphor. That's not how the industry works. It's most people listening to this will know, it's much, much more complex than that. You need a different way of looking at it. Complexity theory gives you that. In the book, I draw the comparison with the apothecary's garden. In times gone by, when the business model of the pharmaceutical industry was the apothecary, the apothecary usually had a garden at the back of his shop, and he managed it for the optimum yield of the optimal herbs at the optimal cost. Actually, I say he; it was usually his wife who managed it. It's an interesting work on it. And I'm looking at this from the point of view of, if this is a complex adaptive system, how do we manage it so that we get both innovation and affordability? Because if we don't get both of those, the social contract will break down. And that would be a disaster.
Yeah, and I love that thing I mean, in a way, your analogy with the marriage was wonderful, because it's almost like as the debate's polarized, people just started shouting insults at each other rather than trying to understand each other.
It's interesting. A couple of people I've been engaged in talking to, and I won't name them to spare their embarrassment, but they've got really stroppy with me. They're really unhappy with me, and it reminds me, because they're at either side of the debate.
Yeah.
And it reminds me of nothing so much as being a marriage counsellor, and the couple, each of them is trying to get me to say they are right and the other one's wrong.
Mm-hmm.
And I'm, that's you're both right to some extent, you're both wrong to some extent. But if you want to make this work, you have to understand each other, and that's really where I'm coming from in this book.
Yeah, and then so going to take you through the book now. It was sort of interesting, the rabbit holes that we could go down, but in the interest of time. So I mean, first of all, there's that, how important the question is this, and I think you've just given a hint of, this is a problem that everyone wants to solve. We might have different approaches to doing it, but your your introduction of, let's be careful if you're going to tweak an ecosystem, that you're not going to do it harm at the same time. So could you give a sort of hint of why that starting point?
Well, we see that if we stick with the ecosystem, the parallels with natural ecosystems, or saying, we've seen that before. I mean, Americans listening to this will know about the Great Dust Bowl of the 1930s, where this new technology came along called the tractor, and yields went through the roof, and in the process they destroyed all the root system, and a few years later you had the Dust Bowl. We had the example of the Grand Banks fishery off the coast of Canada as well. And it's quite imaginable that would happen. I mean, it's not so long ago that we had HR3 going through Congress in this idea that, well, we'll just import reference pricing from Europe, which, don't misunderstand me. That's not to say that there isn't some value in negotiating and managing prices, but importing your HTA from an entirely different healthcare environment is not a sensible thing to do. And the same way works the other way too. We have a system where what's something like 8,000 recognized diseases, and only about less than 10% of them have any sort of management or cure. So let's not kid ourselves that the ecosystem could work a lot better than it does. I'm worried about ecosystem collapse, but I'm also worried, like the apothecary, or concerned, like the apothecary, about how we optimize the yield of it, so we get the best value out of it. And although we use things like new FDA approvals and so on as a sort of proxy measure of the productivity of the system, they're not very good measures. What we want is as much value for society as possible out of it. And because if society perceives that it's getting the drugs it needs at prices it can afford, it will continue to do all the stuff that it needs to do to make it possible. If it doesn't, it won't. And there are plenty of unreasonable people that are willing to, for political or other reasons, to mess up the system.
Yeah, and I think one of the questions that you addressed early on is how important is America in all of this? Because we do tend to track FDA approvals. I think I just pulled out this morning and prep for this. I mean, 22, we do have a problem anyway. We've only got 28 this year so far versus 42 at this point last year, and there's a possibility of a very poor outturn for this year, which has got reasons. But you also point to the US hasn't always been the dominant force in our industry. That it was Germany and other things happened to change that. So it's an ecosystem that is where it is, but it's not necessarily perfect.
I focus on the book on the importance of the USS, partly for two reasons. Partly because of its huge disproportionate influence on pharmaceutical innovation, but also because if you're going to do any sort of rigorous academic study, you need to focus the research. You can't research everything. And any study that tried to study both the US and anywhere else in the world would be far too wide. The US is such an outlier in the way it behaves, because of course we're not just talking about what happens in academic labs and in biotechs and in pharma R&D. we're also talking about the insurance system and the PBM system and all of the stuff associated with that, because that is all part of the pharmaceutical innovation ecosystem.
Hmm. Yeah, and as you point out, there's a declared interest from China and others in entering the game.
And that's one of the reasons we have to be careful about how we manage the ecosystem, of course, because the pharmaceutical industry is a jewel in the crown of the US economy, and to a lesser extent in Europe too. And we could very easily damage it, which is not to say we should disproportionately protect it and society should suffer because of that. But we could very easily damage it. And there are many countries, not just China, who would just love to have the dominance that the US has in pharmaceuticals.
Yeah, yeah. So one place where I found myself nodding as hard as I could was, you define innovation the same way that we do, right? In our innovation index, which is, did you get to market and did anyone write prescriptions for it? Did they want it when it got there? Could you start with just some depth on, why your definition of terms was really important all the way through?
Well, I was very early on in my academic research career. I remember I was introduced this quote by Voltaire, who said, if you wish to converse with me, first define your terms. He was actually making a play on words. He was actually saying two things. First of all, we have to define what we're talking about, but he was also saying, if you want to talk them through, you'll have to pay. So that's a little play on words he was doing. Yes, I define innovation. Innovation is only innovation if it's valuable in the eyes of the recipient. Okay? But also, innovation is multidimensional. Okay, there is high-risk innovation. There is relatively low-risk innovation. There is innovation which is valuable to a small number of people to a large number of people. There is innovation which is discontinuous and takes small leaps. There's innovation which is small and incremental. So, which is why, of course, a simple measure like new chemical entities registered or something is a pretty crude proxy. I mean, we can use it, but we shouldn't be fooled into this idea that all that matters is FDA approvals per year. That in two parallel universes, you could have two FDAs, one of whom approved 100 drugs a year, the other one of whom approved 50, and the one that approved 50 could be adding more value to society easily.
Yeah, and and we've seen that with some of the stuff we publish as well. I mean, some companies have been phenomenal at getting US approvals, but have had no sales as a result of them, and some have had very few and done very well. So there's no.
But even sales, I think one of those where my definition is takes a slightly different perspective from your innovation index, is that it's sales are important, and we're using them as a proxy for societal value to society. But of course, it is only a proxy. There are drugs which sell a lot, which don't necessarily offer that much value to society. I'm thinking about drugs that treat frown lines, for example.
Yes, yeah. And as you say, actually, there is no. We don't do it. No one else is really tracking that sort of value to society, because clearly there's a lot of value left on the table for studies that people aren't doing or drugs we're not developing as well.
Think of all the conditions for which there is no cure or not even any kind of management. I'm sitting here nursing my osteoarthritic knees, thinking, do something, industry, and there are lots of other conditions too. And that commercial challenge remains a challenge for all of it. I remember sitting 25 years ago looking at someone with a disease modifier for osteoarthritis that clearly could never see the light of day because you would never know that you were benefiting, right? So, so people would be reluctant to pay and so forth. And maybe that could be a useful way of saying, look, that pull from the kind of commercial, if everyone's interested in dollars and whether we're getting too many of them or too few, I guess that pull describe some of the selection pressure for the, you use the kind of metaphor of habitats a lot on the way through. So do you want to, tell us, as you go through the sort of discovery habitat and the development? I'll do that. But first of all, let me very quickly pick up one thing you said there about, profitability and sales. Remember, the selection pressure on the industry is not sales or even profit. It's not even return on investment. It is risk-adjusted return on investment. That's what matters, and that's particularly important in our industry where the risks are so complex and so large. So to go back to to answer your question about habitats, the first thing that I discovered in the research for this is that there are all of these entities that are constantly interacting, okay, but they don't interact. Everybody interacting with everybody to the same degree. They cluster, and they cluster into habitats. And in the book, I talked about 7 habitats: the discovery habitat, the innovation habitat, the coalition habitat, value habitat, pricing, patient habitat, and so on, and competition habitat. And the reason that's important is that all ecosystems have habitats, or made up of habitats. But an ecosystem doesn't work unless each of its habitats work. They all have to work. And essentially, each habitat has to contribute something to the ecosystem. And each habitat makes a different contribution. And I having thought of it that way, so okay, well, what do these habitats, having uncovered the 7 habitats and come to this conclusion about they need to contribute, what do they need to contribute to the ecosystem in order for us to have a sustainable, affordable supply of new medicines? So we do have innovation, but we can't afford it, and it's economically and scientifically sustainable. And so then I looked at each of these habitats, and in the course of the interviews, I essentially asked the questions: so what needs to happen here in order for us to what does it need to contribute? That habitat need to contribute to the ecosystem, so that ultimately we get what we want. And so let me give an example. So, for example, the discovery habitat, quite obviously, academic researchers, the NIH, some philanthropists, and the job of that habitat is to contribute new knowledge into the ecosystem. But not just any old new knowledge. That new knowledge has to be of a decent quantity, and it has to have certain qualities, such as its relevance to societal needs, and importantly, its predictivity. That is, you might have read Chris Austin's work when you headed up MCATs for NIH. It has to be has a high degree of being translated through into innovation, and frankly, it's not very good at doing that. When you talk to the innovators who take that knowledge and try and turn it into drugs, they talk about having to duplicate work and these huge amounts of the valley of death as it goes from academia into innovation in industry, and our industry doesn't do that very well. So the discovery habitat doesn't do that very well. Take an example. I could go through. I will, if you want me to, go through other habitats and talk about what they should contribute and what they should and how they feel doing that. But that's essentially the premise of the book, that if you look at these 7 habitats, you can understand what they need to contribute, what they're failing to contribute, and then that leads to what we need to do to fix the system.
Yeah, and I think in that interaction, you see both the sort of opportunity and the challenge, right, which your book addresses. Of some single issue folks talk about improving discovery in order that everything else gets better, and you go, well, of course it might not, just as a result of AI-based discovery companies producing more drugs for a failing innovation habitat. It makes a lot more sense than that.
You raise an interesting point there. The industry is the ecosystem is full of single issue folks who think the answer is, for example, AI, or the answer is how we change the patent laws, or the answer is this or that, or whatever. And they're mostly right, but their answers are, as the expression goes, necessary but not sufficient. And I think those people, when they read New Drugs Fair Prices, they'll recognize their issues in there. Okay? But it comes back to this thing: if you have to manage an ecosystem, if you have to manage the apothecary's garden, as it were, okay, you have to do lots of different things. Now, you know, farmers and agriculturists used to think that, well, you know, this is easy, really. That if we want to increase the yield on our orchard, we just zap the field with DDT. And they quickly realized it had unintended consequences. And what the book argues is that if you try any of these, if you focus on any of these single issues, A, it won't be sufficient, and B, it might well have unintended consequences. So if we just had price controls, you know, if we passed HR3, for instance, and just had price controls, then there would be an impact on investment and innovation. Okay? If we just leave free pricing, then the direction that innovation will take will be, as we're seeing, for instance, into what in other work I'd call the obligation exploiter niche. You know, ever smaller niches of with impacting on ever smaller populations, but charging ever higher prices, and that will fray the social contract. So you have to treat it as a system, because it is a system. And it's naive to think otherwise, I think.
Yeah, and it's an unfortunate, inconvenient truth for folks, right? Is that it might be hard rather than easy to fix some of this stuff. And you know, I like that. So you know, clearly, you've established no one disagrees that it's vital to our society. You then essentially, you know, the conclusion is that the current ecosystem is not healthy. Could you, you know, I think we just thought, you know, they've moved to a farm this year, and one of the things I'm very aware of is some things grow that you don't want to, and some things don't grow that you do, and some things will take over if they can. But you know, your view of the apothecary's garden is that it's essentially unhealthy at the moment. So what was your definition of unhealthy, and you know, and where do you start to see glimmers of hope?
Well, coming from the point of view, what do we want this ecosystem to deliver? We want it to deliver lots of drugs that are societally valuable, which is a combination of how good they are and how many people they affect, and that we can afford, that are affordable. That doesn't necessarily mean cheap, of course. You know, some drugs are going to be expensive. That's what we want the system to deliver. Okay. As I argue in the book, we're not doing a great job at that. And of course, there are some fantastic drugs, you know, and you know, the industry's apologists always, you know, trot out Sovaldi as the classic example, but there are lots of others. Okay, most people listening to this are alive, or their loved ones are alive, because of something the pharmaceutical industry did. So there's lots of good examples, but there's a lot more we can do, and the cost issue is becoming worse. Now it's been exacerbated. You know, you and I are both old enough to have seen the exacerbation of this problem as we shifted from small molecules to biologics, and we're seeing it now with things like, you know, some of the immuno-oncology products. But as cell and gene therapies get into their stride, this problem will be amplified even further. Okay? And to go back to my arguing couple metaphor, you know, it's bad enough if you're bickering when you're both single and working with relatively little strains on it. When you start having kids and the money gets tight and those sorts of things, then you know the tensions become worse.
And so, someone's just gone and bought a Porsche.
That's right, exactly. So we need to think about how we manage the system so it'll give us those things. Otherwise, it'll give us the drugs we want at prices we can afford, and sustainably. When I say sustainably, of course, that's another way of saying so that the industry can make a reasonable return on risk-adjusted return on investment. Because if it doesn't, those same people that say how much they love the life sciences industry now will just pick up their money and go invest it somewhere else.
Yeah. And in all of this, the sort of role of the apothecary is important, because you know the industry doesn't have a central controller who can manage that. You know,
that's an important point. So in the book, and you know, we wouldn't have time to go through I identify in the 7 habitats, I identified 31 problems. Okay, now, when I try to write a New York Times bestseller, I try to boil it down to, the 3 things we have to fix, but that's just not the way complex adaptive systems work.
Yeah.
And there are about 27 things that we need to do to solve those 31 problems. But and the interesting thing is that because it's a complex adaptive ecosystem where everything interacts with everything else, you can't cherry pick those 27 things. You can't say, "Oh, I'll do that one, and that one," and or you can't say management consultants are very fond of the Pareto principle and say, "Well, let's just pick the 20% of things that will have 80% of the impact." That's not the way complex adaptive systems work. And so you have to do all 27 of these things. But by way of thinking about the implementation, because I'm very pragmatically oriented, they do sort of coalesce into 3 streams of activity. And so towards the end of the book, I talk about these 3 streams of activity that they coalesce to what we need to do. There's I avoided in the book, I made a deliberate point of avoiding the word moonshot because it's become cliche. But there are essentially 3 big, hairy, audacious goals that we need to achieve. The first one is we need to make innovation more valuable. That is, more new drugs that have more societal impact that are more affordable. Okay? And that involves all sorts of things, such as fixing the translation problem, but also things like the cost and inefficiency of the coalition habitat, which is where you pull together all of the entities needed to develop a joint venture capitalism. So the first project is the Valuable Innovation Project. And the second of the 3 is the Valid Value Pricing Project, so that we change the system. There's a whole load of things we do, including value-based pricing, so that the prices that are charged for drugs relate to their value. And that's not the case at the moment. And the third of the 3 projects is the Managed Competition Project. That is, so we make the market work so that competition actually works. Now, and that includes things like changes to the patent and regulator exclusivity systems, because the system does need forms of temporary monopoly. But the 2 things that we need to improve about that are, one, that monopoly is used to incentivize real value. And the system at the moment isn't very good at differentiating between according to value. And the second is that we need to make it more predictable and less gameable, so that both innovators and imitators, generics and biosimilar companies, can look at it and say, right, the point at which I'll be able to imitate, or the point at which I'll be imitated, is this point, and not somewhere in that 30-year window. So there are 3 big projects that need to be done. And to go back to your point about there is no apothecary, there is no central innovator, I think that's a really important point here, because to do these things, the government can't do these, whichever government it is. The industry can't do it. There is no one entity within the system that can do it. It's a societal project. It's a societal problem, and it's a societal project. And at the end of the very last part of the book, I come down to that sort of call to action, that if we think this is what we want, if what we want is a good supply of drugs that are valuable to society at prices we can afford, and that's sustainable so that the industry survives, and all those other good things, this is a thing that society needs to work on together. Now, governments have a dominant role in some parts and take the lead. The industry has a role in some parts. Patient groups have a role in some parts. But we have to do these 3 things. Otherwise, we risk the marriage falling apart. We risk the social contract failing.
Yeah, yeah, and I thought it was really interesting to continue to bring that kind of ecosystem thinking. I was looking at the story of the Great Barrier Reef a
Mm,
couple of weeks ago,
mm,
and that was predicted to have died about 5 years ago,
mm,
and now it's healthier than ever, it seems. And actually, no one was forecasting it would
mm,
become healthy again, and it seems like there was no one person intervened. So, I guess one of the big, which is nice to hear, but one of the big questions is how soon you would be able to tell it was becoming unhealthy, and how quickly you'd be able to tell that it was becoming healthier, because some of these are 10, 20, 30, 50 year.
these are generational projects, but where we are now, where we sit with the pharmaceutical innovation ecosystem now, is the result
Mm,
of things which happened shortly during and shortly after the Second World War.
mm,
And lots of consequential things afterwards, things like the thalidomide disaster and regulatory changes, and then the biotech revolutions and all of those things. But ecosystems don't change. Again, that comes back to this thing of, let's get away from this mechanistic metaphor that you can somehow just
mm,
change a part of the machine and things will change. Um, you have to manage it as a complex adaptive ecosystem. And the first step to managing it is understanding it. And that's what I've tried to do, or at least make a contribution towards in the book. Um,
yeah.
I, uh, I rate John and Peter's books, for example, highly. I enjoyed reading them. I very much enjoyed speaking to both of them,
Mm,
and adding their thoughts into the book. But I do take a much broader, wider, more holistic view than they do, I think.
mm,
I think there's, whether you're on, broadly speaking, Peter and John are both on this industry side of the equation. Whether
mm,
you're there or whether you're in with the equally strongly motivated people on the other side who think the industry are villains and would control prices tomorrow and turn it into a public utility. Whether whichever side you're on, you will find things in this book that you will agree with, and you will
yeah,
also find things that you vehemently disagree with.
yeah,
Um,
yeah,
but
yeah,
that
uh,
is
yeah, and
exactly.
yeah, and I was keen actually not to try to go through this with you chapter by chapter, because I think, as I said to you, this is one of those books that's sort of incompressible, because a lot of books just have a sort of central thing that you go, okay, I think I understand that after the end of the first chapter. Yours isn't one,
It goes
so
back to my
uh,
my my metaphor about being the marriage counselor between this warring couple.
mm,
Whatever I say, they will hear, they will agree with the bits they agree with, and just. But the truth is,
mm,
they've got to understand each other, um,
mm,
and because we want this couple to stay together. We want society and the pharmaceutical innovation ecosystem to work together and
yeah.
carry on doing, because there's still much to do.
Yeah. No, there's definitely risk in that adversarial approach. There's a book, Monica Guzman's I Never Thought of It That Way, which talks about sort of, the challenge of polarity, and especially in the political debate so
Mm.
often now, and therefore distillation into these simple levers,
Mm.
and batons that people are using against each other. Um,
It's like everything else, as we struggle to stay fit and maintain a healthy weight and all of those things, the people that the snake oil merchants to come along and say you can do it with just this exercise, or you can do it with eating just type of food. We know that's just not the way the world works.
yeah, yeah, yeah. How important? Just, I mean, and I would recommend people do read this book. How important, before they start, do you think it is? Do you think they need to be comfortable with ideas from evolution, ideas from
No, they shouldn't do
biology,
that.
and so forth?
I sat down at the beginning and thought, who am I trying to speak to? This is the
Mm,
first thing an author does. Who am I trying to speak to? And I'm trying to. I'm not really trying to engage the people at either extreme of the debate. I'm trying to talk to people in the middle who regard pharmaceutical innovation as important,
mm,
but don't necessarily have pre-knowledge of how the system works. I've tried to write it so that an educated layman can understand it. An industry expert reading it will read bits and say, yes, I know that bit, or Brian has clearly approximated or summarized it at this point, because I've written it for a more general reader. Partly because one of the interesting things I found is even the industry experts you speak to, they are experts in their area, but they're not experts in the system. Yep. So you have to write it in a holistic way. And I also wrote it so you don't need any pre-knowledge of evolutionary science or ecology or anything like that. I've tried to explain those things with lots of metaphors, and you probably notice in the book that it's as well as the main text, there are lots and lots and lots of footnotes where I try to use ecological, biological, and other parallels to explain things. So I don't know if you saw, I was just thinking about my saxophone here. I was trying to explain the difference at one point between translational research and translational science. And eventually came to me that translational research, that is, trying the work you do to convert a piece of scientific knowledge into a drug, differs from translational science, which is about understanding how the translation process works and why a model isn't perfect. And so it's exactly like my music. My saxophone teacher gives me in my saxophone lessons. It's okay, so we're going to spend some of the time working on scales and arpeggios and the theory, and then we're going to spend some time learning a tune. Now you need to do both, but translational science is more like your scales and arpeggios, and translational research is more like learning a tune. And of course, what has happened in the industry is to some extent we're all so goddamn determined to play a tune that we've, to some, what Christopher Austin's point is, we have to a degree neglected our scales and arpeggios, and therefore it takes us longer to learn the tunes, and it's more costly to learn the tunes.
And he's an opera singer, right? If I remember, Christopher Austin.
I don't know.
And I think that's his one of his claims to fame is that I think he was a professional opera singer, so he definitely would understand that metaphor for sure. I think that's exactly right, and I think there are those folks that think that this is a technology problem, or that this is somehow as you say, a kind of machine or a mechanistic problem rather than a human challenge to get our heads around.
Interesting. One of the inspirations for this book, I read a book what we shortened before I wrote this one, and forgive me, I can't remember its name now. It was about the drawbacks of metaphors. Now, we all use metaphors all the time. They're incredibly useful. But in one of the things this book says is that there have been episodes in history where metaphors have held us back. Okay? And the classic example is flight. So for centuries, we tried to fly by looking at birds and think, well, how do we build machines that flap their wings? And that just doesn't work. Okay? And if we'd have forgotten the bird metaphor and thought about it differently, we'd have learned to fly faster. And I argue in the book that the machine metaphor, this idea that pharmaceutical innovation is a machine with a big knob on it where you turn it for more money or less money and you get more or less drugs at the other end, is another metaphor that's holding us back. In fact, the ecosystem metaphor using ecosystem in this book, I'm not really using it as a metaphor. What we have in pharmaceutical innovation is not like an ecosystem. It is an ecosystem. It's multiple entities that interact with each other and adapt to each other. That is a complex adaptive system. It's not like a complex adaptive system. It is a complex adaptive system. I think that's a really helpful illustration. I don't think it is the book that you're referring to, but I know Surfaces and Essences, the Douglas Hofstadter book, talks about the role of analogy in a lot of this. I don't think necessarily scientists, do know that they use analogy all the time, and I think some of that is definitely an issue because it can be misleading as well as useful for them and others. It's a double-edged sword. Just think how we were held back in atomic theory by thinking about atoms as kind of billiard balls, and when that broke down, we shifted our thinking.
Yeah. And that's a really good segue into two things. I think how we think about things is clearly going to be very important going forwards, and I'd be interested, certainly when direct people towards your book. Do you have other books that you would recommend for folks who are aspiring innovation geeks or pharmaceutical geeks?
I don't know. I think at the risk of self-referencing, which is always a sort of sin for academics, if they find this topic interesting, they'll find Darwin's Medicine interesting, which is the book about the speciation of business models. I wrote about the speciation of business models in the life sciences industry. There are lots of good books. To be honest, a lot of the books I read are not popular science type books. They're extremely they're extremely interesting to me, but they're probably hard work for if you're not of this warped mind that I have. So I'm reading a book at the moment about Pasteur's quadrant in innovation, which is the idea of using fundamental theory to applied purposes. It's called Pasteur's quadrant, and I'm very interested in this topic of how we use fundamental concepts towards applied ends. It's something that I find one of the frustrating in our industry, because you and I know our industry well. I often I think it's something that our industry is weak at in its commercial side. So let me explain briefly what I mean by that. We would call ourselves a science-based industry, and if I'm standing in front of a board, as I sometimes do, I'll sometimes play this game where I'll go over to the R&D, head of R&D, the chief science officer, and say, so tell me, how many of your people, your senior people, how many of them have PhDs in science? And he laughs at me and says, well, what a stupid question, Brian. They all do. I mean, you don't get in the door unless they have a PhD, and they're like, okay. And I wander over to the chief commercial officer, the chief strategy officer, or the chief marketing officer, and your guys? Oh, well, some of them have PhDs. In what? Well, in science. So how many of them have PhDs in strategy or economics or organization and management? So, no, almost none. And we, as an industry, we neglect that side of things. There's a good evolutionary reason for it. The period after the Second World War, when we invented, beta blockers and ACE inhibitors and all of those things, they were so fantastic compared to what went before that actually you didn't need to be brilliant at marketing and commercial. They more or less sold themselves. So there was no selection pressure to become as good at commercial as we were at science.
Yeah.
And so even today, the competency and the levels of abilities and the technical prowess, if I can call it that, of our guys in R&D is greater than it is in commercial, which is not to say that everybody in commercial is stupid and unskilled, of course, but if you did the comparison, the acid, there's a little acid test that I use sometimes. So let's imagine that I went up to all of the chemists in your R&D department and asked them to define molecule, atom, and ion, and they could all do that, and I'd get a definition for each, and they would all say the same thing, and they would all differentiate between those two things. I then go over to your commercial department and say, okay, get 100 of your chief commercial people, ask them to define strategy, tactics, and objectives. I'd get at least 1,000 definitions, and they'd all blur and intermingle.
Yeah. No, it's a bugbear of mine, and I think actually go back to your correction of me with the commercial pull. That it's a risk-based commercial pull. I think the understanding of risk is terrible. I think the understanding of decision science is really poor as well. Next to some of those portfolio conversations, and of course that as you say, there's a lot of room for improvement, or for someone who can, you look at the future of cell and gene therapy. Is it just to stamp out one therapy and have a P&L per drug, or have a tech-based approach or a Netflix-based approach? And but you need people that can get their heads around that and then say yes to it. That's there's a couple of challenges.
And I'm lucky enough to work with many CEOs and commercial leaders who are getting their heads around it. But there's still a disparity between the number and proportion that think like that in commercial versus really switched on technical guys.
Yeah, absolutely. Brian, this has been as much fun as I thought it would be. Can you, if people want to find you, what's the, what are the means of doing that? Twitter, LinkedIn?
Well, I've actually just rebuilt my website. So if they just look up pragmedic.com, PRAGMEDIC, it's a portmanteau of pragmatic and a medical, pragmedic.com, you'll find all my work. There's 300 publications, and you can ask for anything I published. As far as the books are concerned, anywhere you buy your books. I also do a podcast called Dawn's Medicine, and I have a YouTube channel, Professor Brian D. Smith. Depending on how you like to digest your information, then use that. But you can request any of my PDFs of any of my previous work from my website at pragmatic.com.
Fantastic, and we'll include those links in the show notes as well. So, Brian, I'm sorry it's taken so long to get you here. Is this? I guess you'll be working on this book for making sure people do get to read it. Is the next book already in mind, or are you?
Yeah, I think I know what I'm going to do. If you're interested, I write a column and have done for many years now in Pharmaceutical Marketing magazine called Dawn's Medicine. And in it, I take these parallels between biological evolution and organizational evolution, the evolution of our industry, and how we can learn lessons from that. So I'm going to, what I'm thinking of doing is taking, I've written dozens and dozens of these columns now. I'm thinking of taking 10 or 20 of the ones that have evoked the most response, and turning each of those into a chapter.
Nice.
So, I was joking with my wife the other day, I'm going to call this book something like Charles Darwin's CEO or something, because it's about how evolutionary theory, Darwinian evolution, can apply to business. There's one of the quotes that evolutionary biologists like to use is that you've probably heard by Zelensky, who said, nothing in biology makes sense except in the light of evolution. And I think that's true for business too. Nothing in business makes sense except in the light of evolution. And I think that's what the next book will be about.
Amazing. Well, clearly it's going to be, actually evolution's come up a few times in this. I remember talking to Stephen Johnson on the podcast here about spandrels of San Marco, the kind of this famous Stephen Jay Gould article, which I think actually does describe some of what we've got in our industry as well. So, Brian, this has been fantastic. I feel like we need a separate conversation about Newcastle United and
well, we'll do it next
and innovation.
When you emerge from the wilds of Norfolk and get down to London, let me know. We'll go out and we'll have lunch and we'll have a chin wag and a beer.
Sounds good. That was amazing. Thank you, Brian.
You're welcome. It's been a pleasure.
That's it for this week's episode of Idea Collider. To continue the conversation, visit our website at ideapharma.com. Follow us in your favorite podcast app so you never miss an episode. Don't forget to rate and review us on Apple Podcast. Until next time, I'm Mike Rea, wishing you great success.